Okay, we now move on to the next question, which is about our voice. And I'd like to introduce you to Paddy Burke and Elizabeth Harkness.
We are worried that our voices will be lost nationally, regionally, and locally. We are worried that consultation is not real, that co-production, choice, control, personalisation, and patient's experience are words are used when you want us to make quick comments on what you are doing, or when you want to pretend things are getting better.
Elizabeth? Elizabeth, you can go.
What are we doing to make sure when we talk about people know something that is offered people with learning disabilities and their families, that you are to make sure that you are saying is really about what they up to want.
Yeah, go. No, it's done. We've done. All right.
The important thing is that you get your voices heard, is because we've had a lot of people who've been abused in the past and who've sat back silent. It's not because they've sat back, because they didn't know how to go forward. Also is that, are we going to let things like that happen all the time? And we're going to keep coming back saying is, well, you know what, if them people had a voice, things like this wouldn't happen. That's why I apologise that the forum hasn't been there for the last 2 or 3 years for you. We're here now and we're listening. And me and my 2 colleagues on the 10th and 11th of March, we are going to go back to the National Forum, and we're going to tell them is get off your arse and do your job, because is that, for one, the government keep cutting back our staff. We're losing staff like left, right and centre. People's money is getting dropped down instead. I mean, you're on crap wages anyway, but the wages could be better. If we don't start listening to our people, we're going to go back 50 years. And that's why I say the National Forum is there. You have to question it. What are we doing on that National Forum? And we've got to stop this abuse going on. People think because it's in big hospitals or secure units, that's where the abuse is going on. Excuse me, the abuse is going on in people's homes and where the one-to-one. Things like that. We've got to protect people. Like this lady said before, is that to keep people in our own community, in their own community, by family, by friends and that. So what? It costs us a bit of money. But do you know how much it's costing us by sending people miles away? Millions. And we're wasting millions. And we're still wasting millions today because we're sending people out the area. We need to get our own people back. And it's about time, the members, is that we stand together as one and start networking. And I was glad that he's invited us here today, because I'm here to take back with my 2 colleagues. We are listening and we're going to start doing. But starting after next week, after the next reform, I need to start hearing from you guys and saying is, why haven't you done this? Why haven't you done that? When we think it, because one of our first subjects is hate crime, and we're going to do something about it. And like Gavin said, we've done something about it on the forum, and we're doing something about it again.
Since valuing people, I feel things have gone backwards with people's voices, and this is why I've been, because as you know, I'm a member of a parliamentary party, and I've been talking to them actually about this, and I think we actually should be going the same way as the youth parliament, and actually having parliament in the Houses of Commons, and actually having our voice like the youth parliament, because they have such a big impact. And I think that is the way forward and I've been talking to the Labour Party about this when getting back into power, that we need to get this happening so that people with learning disabilities have their voice again, because they've been delimitalised by this government.
Just a plea then, as we started off the day talking around everybody working together, just a plea, please do. What we've done is that we've circulated some contact details. We're very, very interested to hear from you, listen to you, because you are able to help us shape both nationally but also in local areas. We are listening and we want to hear you. Okay, thank you.
I just wanted to respond to the question about consultation and the fear that they're not always real, and hearing the voices, and to let you know that organisations like clinical commissioning groups are required to listen to patient voices. It's written down in our rule book now that we have to listen to patient voices. So if you invite us out, we'll come out and see you. We also have public board meetings where if you don't feel like we've heard your voice, you can ask questions. And I know that sometimes can be challenging, but you can ask questions. You can also write to people like me, and we have to respond to it. So whenever we design services or we go out to consultation, we have to be able to demonstrate that we've consulted with all of our population. So hold us to account on that. We have annual general meetings, which again, you're invited to. So we need to make sure that that's a real opportunity for you to come and say, what have you done for us and how have you improved our health? So we'll make sure that we take that forward. But it's a two-way conversation. So there's some responsibility for you to tell us, and then for us to tell you how we've turned that into service and helped to improve what you get as a customer of health services.
Just picking up the point around people being listened to, and shared Gavin's anxiety about the change around the Valuing People team. And there was concern about whether the voice of people with learning disabilities would start to get quiet within government. I'm pleased to say that the national lead for ADAS, Andrea Pope-Smith from Dudley, works with Gavin and others to really promote, drive and keep it high on the agenda of both local councils but also central government. There is also something about listening to people, but it's really important to hear what people say. So when we do consult, when we do go out and have those conversations, the challenge back to people like us is to say, well, have you heard what I've just told you, and really test that out.